Hello. All right. Hello, Dr. Simon. Good morning, and good morning, all of our listeners. Today, I'm excited to
Morning.
be here with one of my close friends, Dr. James Simon. My name is Adrien Cotton. This series is called Looking Good and Feeling Good in Our 40s and Beyond. So both Dr. Simon and I are incredibly passionate about helping women feel better in their bodies. We do it from different points of view. His is a medical and mine is more lifestyle. And you're going to learn more about what both of us do to work together and what both of us do to help women in our practices. So my name again, Adrien Cotton. I am a midlife women's wellness expert, and I'm the creator of Master Menopause Now, an online program intended to help women through the phase of perimenopause, menopause, and well beyond. I'm here with Dr. James Simon. And I wonder, Dr. Simon, would you be so kind as to introduce yourself and then tell us, let's go straight into it. Tell us about perimenopause. What's that? Menopause. Maybe you can dispel some of the great big myths out there about menopause. And then tell us from all of this from a medical perspective, because then I will be filling in from the lifestyle perspective.
Sure. My name is Dr. Jim Simon. I'm a reproductive endocrinologist by training. That means I'm a overtrained obstetrician gynecologist. And early on in my career, I got very interested in the hormonal effects of aging and menopause. And as a result, I have become the president of the Menopause Society and the Sexual Medicine Society. And I'm working very hard to bring what I've learned over more than 40 years of education to my patients. I have a practice in downtown DC where I see patients literally every day, and I'm clinical professor at George Washington University.
All right. That's all.
That's enough. I do clinical research and I've published 800 papers, but beside that, I've been sitting on my laurels doing nothing and eating bonbons.
Right. Of course you have. Yeah.
So
You're just a little passionate about this topic.
I am. So you asked me, what is the perimenopause, and to dip my finger in the menopause.
Right.
The perimenopause is actually a stage in a woman's reproductive life when, because of her age and the reproductive cycle, she's running out of eggs. She's running out of eggs. And the eggs that are left have different characteristics than the ones she's had ever since her menstrual cycles started. And it has a number of health consequences. The hormones are different, the cycles are different. The fact that they're different makes them unpredictable. And there's major effects on mood, food, sex, well-being, etc., just as a result of those natural changes. Ultimately, those changes stop because she runs out of eggs, and we call that the menopause, where there's a pause in her cycles for a year or more, and we can talk more about that later.
That's a lot of change in a woman's body.
It's an incredible amount of change in a woman's body, and it's really an important time because historically, when humans lived a very short amount of time, let's say 50 years was beyond what any of us used to live, the average woman would already be dead long before her menopause. And so it wasn't an issue. But now we, due to health and hospitalization and sanitation and food, we live a long time. On average, a woman's going to live into her early 80s and a man about 80. That's long past the age of menopause, which is about age 51.
Wonderful. Well, let me tell you, and I think we met each other many years ago when I was in my own, what I call, as you know, affectionately call it my perimenopause prison. And speaking to the symptoms you had, and then I also had the other one that you didn't mention, although you probably didn't mention it because most women should already know that it's sleep deprivation. So I was suffering with sleep deprivation from a son who had night terrors, who was running around the house because he thought he was being attacked by a dinosaur, night sweats, worries about everything in my life from work and what people thought about me. I had unbridled anxiety. I experienced vaginal dryness, but I didn't know that's what it was. I was just uncomfortable, but I didn't know that's what it was. I also experienced weight gain that I had never seen before, and I owned a fitness gym, very much a thriving one in Old Town Alexandria. Then over the course of time, I started to work with other women in their 40s and 50s and recognized that they too were experiencing the long list of symptoms that I had started to really research, because I knew if I was feeling this miserable and I couldn't shed the pounds that I used to be able to shed by not eating for a day or two, something must be going on. So a lot of the women with whom I worked over the course of time were having the same symptoms. So I decided at that point, I wanted to exclusively work with women in midlife, so that I could help them learn there's a whole new way of looking at your wellness now that your brain and your body is incredibly different. And that's what I do today. I help them establish a new mindset about health and wellness and longevity, and not simply what society may want you to believe, and that is that you focus simply on diet and exercise. You can check the box and walk away.
Doesn't work that way most of the time.
No,
And
particularly in this phase, right, Dr. Simon?
yeah, this is really one of the big cruxes in healthcare, and it goes beyond the perimenopause. We think everything is normal when it occurs naturally, but it doesn't mean that you necessarily want to have it or suffer with it. For example, those symptoms that you were having, Adrien, they are completely normal and expected. It
Yep.
doesn't mean you want them. You know,
No, definitely not.
tooth decay and hemorrhoids are normal. That doesn't mean you want them. So,
This is true.
so we make accommodations. We do things. We change behaviors. We change lifestyle. And as we're going to speak in a minute, we look at the underlying biology of those changes, in this case, the hormonal changes that occur in peri and post menopause, and we decide one-on-one individual decision making whether hormones might be helpful for a particular woman in a particular circumstance.
Right. And so, that word hormones may, for some of our listeners, raise heart rates. It may raise a little bit of fear. And I know it did with me. So can you tell me, what is hormone replacement therapy? Not only what is it, but what are your top 3 reasons why a woman should seriously consider hormone replacement therapy? And then after that, I'll follow up with women who they are not candidates for it.
Sure. And this is an important subject, because hormone therapy or hormone replacement therapy is not the same for every person. We need to make individualized choices that are appropriate for a particular individual. One of the problems we got into was trying to make decisions for everybody, and then the decisions are not optimal for anybody. So, hormone replacement therapy is really looking at the hormonal environment of the perimenopause or the menopause and seeing what's missing. What's missing is typically 1 to 3 different hormones: estrogen, progesterone, and testosterone. Those are the 3 categories of hormones that are typically either low or missing in the peri or post-menopause. And then, depending upon what's necessary, giving back that woman what she's missing.
Okay. So it's not only just estrogen replacement. So you're saying hormone replacement therapy, someone may be a candidate for testosterone and testosterone alone for a while.
Absolutely.
Wow. I bet a lot of our listeners don't know that.
Individualization of treatment. Individualization. You, as an individual, Adrien, would not want me to treat you like somebody else. You are not like somebody else.
Right.
You're your own person, and we need to look at you, make individual decisions together, and move on from there. We really got into trouble with this one size fits all mentality about hormone therapy, which every woman listening on this, and every guy also, knows you cannot go into a store or go online and buy the average size and have it fit.
No.
You got to buy the
What
right
may
size
suit you
for
may
you.
not suit me. Right. Right.
Exactly.
So why are we applying those rules to our health and to our lives and our longevity when in fact we wouldn't apply that if we were sitting at a dinner table and eat? Why would we eat the same thing that somebody else eats? Can you tell us, how would a woman know? I really firmly believe, and I know I was one of them, I was not paying close attention to my body. I was putting it on a shelf. I believe that oftentimes women live outside their bodies. What I mean is they're not really paying attention to what's going on with their bodies, not only just their cycle. I have countless of the thousands of women with whom I've worked, they don't know when they had their last cycle. So let's say a woman is really in tune with her body. She's paying attention to her cycle. She's paying attention to her mood regulation, her sleep. What is the symptom of somebody who is lacking in estrogen? How would you know?
Yeah, so the typical woman who has low points in her cycle of estrogen, or her cycle has ceased and she has low levels of estrogen, her primary symptom occurring in more than 80% of women is a hot flash or a night sweat.
Okay.
Disturbed sleep. And this is the body's reacting to a normal event. For example, when you're out on the tennis court in the middle of August in Alexandria, Virginia, and it's 100 degrees,
Right.
you sweat, right?
Sure.
And if we were in Alaska in February with no clothes on, we'd be shivering and freezing cold, trying to keep warm. Well, the exact same thing happens to our brains when our hormones are low. And by the way, men get hot flashes and night sweats also when their hormones are low.
Yes.
Our brains expect our hormones to be in the normal range, and when they're not, the whole temperature is unregulated, sometimes too hot, sometimes too cold, and in between, we feel terrible.
The temperature regulation, number one, as we know, at least 75 to 80% of women experience hot flashes and night sweats. And that is
Correct.
one sign. Okay.
That is the most prevalent sign.
It's the most prevalent sign. Okay.
Other changes include sleep disturbance unrelated to hot flashes at night, loss of or change in one's sexual desire.
Right.
Whatever it was normal for her, now it's either gone or hard to find. And then when she might be engaging in sex, she might have vaginal dryness or pain with sex. And it may be that that dryness is what I call walking around dryness. They just don't feel right down there. Think about it this way. When your eyes are dry, you know it. You put drops in. When your nose is dry, it feels abnormal. If you're giving a speech and your mouth is dry, you get tongue-tied and you have difficulty getting the words out. These
Right.
are all places that are meant to be moist. Well, it turns out that your vagina is meant to
Right.
be moist. And when it isn't, it feels like it's chafing because it's just not able to move in the normal way that it would otherwise. Just like you can't talk when your mouth is dry.
You know, and you raise these issues, and you and I talk about them regularly together and with clients and patients. Yet these are issues that are very uncomfortable for women to discuss, even with their doctors. I believe that both of us are on a big campaign. You've been for 40 years, I've been for 20 years, trying to help women open up and talk about these issues, because there's no shame or secrecy or silence that should be associated with your sexual health. It is part of your health. It is absolutely vital to your health, right? And so we just need to ask women, please start talking about these things, not only with your doctors, but with your friends, with your partners, right? And your children.
Yeah, so we say sexual health is health.
Right.
Because if you're not healthy generally, your sexual health will go down as well, and vice versa. Talking to your doctor may raise an uncomfortable response.
Mhm.
And if he, your doctor, or she, your doctor, is not comfortable with the subject, believe me, in your community, you can find someone who is and who is knowledgeable.
Right.
So seek them out. We're not all trained to be experts in everything.
True. And oftentimes, as I speak, as you know, I speak, oftentimes audiences are very, very surprised to hear that even sometimes our OBGYN is not comfortable talking about it. Could be they were not educated about it in OBGYN school, or it could just be a topic that even they are afraid to talk about. It's okay. You can find someone else. You can find Dr. Simon, you can find me, or there are others in our community, and we would be happy to help you find someone, because having the comfort level to open up and be vulnerable about these topics will only help you.
Yeah, and sometimes women are particularly uncomfortable with me as an older man
Right.
because the perception is that I don't either know or that, because I'm of the opposite sex, I'm not going to understand. But think about this. Most of us have partners of the opposite sex. I'm not saying anything wrong about having a same-sex partner, etc. I'm just saying most of us have a partner of the opposite sex. If you're going to talk to your intimate male partner as a woman, you should be able to test those ideas out on me, and I can actually give you the language that may sit easier with him. So
Absolutely. Yeah.
this is a learned process independent of gender.
Right. Would you tell us who is not a candidate for hormone replacement therapy? I think that will help women also, and men here. There are many women who are candidates who are maybe not ready to tread down that path. But who's not a candidate? Because there are women who are not candidates for hormone therapy.
Right. The two most common reasons that women cannot or should not use hormone therapy are because they've had or recently have had a blood clot either in an artery or a vein. That could be a heart attack, that could be a stroke, that could be a blood clot in their leg, etc. Long plane trip, for example. Or a woman that has a hormone responsive type of cancer. The most common type of those cancers is breast cancer. And if she's on a treatment that's designed to take away hormones from her breast cancer, then giving her back hormones in replacement therapy is counterproductive.
Okay. So are there women who have a family history of breast cancer, or if they have had breast cancer, are there women who have a genetic disposition, a family history, or they have had it. Are there women who are still candidates for hormone therapy?
Yes, it's quite interesting, and it's a terrific question, Adrian. So there are a whole group of women who have genetic predispositions to breast cancer, the BRCA mutation carriers, for example. And they've been studied both with or without hormones before or after they've had their breasts removed, because many of them do have mastectomies because of their risk. And it's been shown in them, hormone therapy has been shown in them to be safe.
Oh, wow.
So
Okay.
just the opposite of what you would think, because you're
Yes.
thinking high risk of breast cancer, strong family history, then, you know, they can't be on it. Just the opposite has been shown to be true. And there are many women who are now distant from their breast cancers who would still like to be on hormones, and they may be candidates. Again, individualization of care, and the field is rapidly changing on that particular subject. So I don't want to make too much of a, one size fits all again. This is an individual question, but it's a really important one because many women continue to suffer with these symptoms and feel as if, or their doctors have advised them that they can never be candidates for hormone therapy. And one more thing that I want to get in here. We now have, fortunately, many alternatives to hormone therapy that can be used to treat those symptoms completely devoid of any hormones. So there's something for everyone here.
That's really exciting. That has to be exciting in your industry to have new approaches
Absolutely.
like this in this era. I mean, you're living to see some really beautiful change that women can make their lives just a little bit easier.
We have tons of tools in our toolbox. One
That's
of the
great.
problems is that many practitioners, they only had one or two tools in their toolbox when they were
Right.
trained. And
Right.
because they were not really interested in this, never really learned about the new tools that came online.
Right. And I'm a big advocate for the medical community with you at the center of it with me for so many years, yet they have limited time. And so how much time are they going to spend on this when they had learned something that was working? It's not cutting down on the number of patients they have, right? And they just don't have enough time.
So,
Yeah.
so Adrian, if a patient or a woman doesn't want to use hormone therapy, or maybe she can't, she's actually investigated and she can't, what are some of the strategies that you would use to address their symptoms of the menopause or perimenopause? For example, their weight gain.
Right, right. Great question. So I really believe whether or not a woman is interested or intrigued or not with hormone replacement therapy, I think she needs to start at a foundational level of health and wellness. It doesn't matter if she's interested or not in hormone therapy. I think we need to start with what do we have power over? And I really do like to teach women, you have the power to own this, to own your body and to own your health. You're on a new journey. The days of the teens, 20s, and 30s of losing weight by sweating a pool of sweat in your gym or wherever you worked out and depriving yourself with salads, chicken, and dressing on the side, those days are over. We need to actually fuel our bodies with movement. And I am a big proponent, as you know, of strength training because at the age of 30, we all start losing muscle mass, bone flexibility, and bone density. So we need to work every day to incorporate strength training. And that means any kind of force. It doesn't have to be a heavy weight. It can be just the force of a table or the floor that you press against. I believe that sleep is the foundation for all of our health, men and women alike. I believe that we both grew up in a generation where we were told the less you sleep, the more productive you are, the better off you're going to be, the more successful you're going to be. Well, our brains need just as much stimulation when we go to sleep than when we are awake. and it needs to cycle through our 5 phases of sleep, 5 stages of sleep, 5 to 6 times. Therefore, we need 7 to 7.5 hours of uninterrupted sleep, even when you're in perimenopause and menopause, of which I am. Sleep is vital. I believe the next layer of your health must be right next to that is your stress resilience. Finding ways to respond to external and internal stressors. We cause a lot of our own stress with what's going on inside our heads, and figure out a way to respond and not react. Just those 2 strategies alone can help a woman tremendously own her health, own her wellness. And interestingly enough, because as you know, I've developed my own conceptual model of wellness, of what it looks like. And I believe when you have a stress and a sleep practice, all of the other practices like your calendar, putting your wellness on your calendar and boundarying your time, filling your bucket first, your food is going to fall in place and your movement is. However, if you don't get your 7 to 7.5 hours of sleep, what's going to happen? Dr. Simon, what happens to you when you don't get your sleep? Are you going for the 5 fruits and vegetables and drinking your 2 liters of water and fueling yourself with lean protein?
So animals, almost all mammals, when they're really stressed, they go for the quick and terrible food. So for example, we're stressed, we don't sleep. What do we choose for our food? Simple carbohydrates, simple sugars, anything that makes us feel good in the short term. And
Yes.
then we crash and burn after that, and we're back to
Yes.
the same problem.
And that is because another hormone, ghrelin, it increases. And that is our hunger hormone. It makes us hungrier for carbohydrate and sugary foods. So
Yeah,
when we get our sleep, it's the foundation.
So just think of ghrelin as the growling in your stomach when you're
Growler,
hungry.
yes,
The
yes.
growl, ghrelin. So yeah, that's absolutely true. And we really have a society with so many pressures on us every day. And I actually believe they're much more on women, particularly at this stage of life when they're caring for their children, who many of them are teenagers and are, having their own issues, their intimate partners, who may be middle-aged also and having their own problems, not to mention themselves and aging parents that may be
Yes.
really sick and need additional care because those aging parents and in-laws, they may be more like young children than adults. So tremendous stress. And I didn't even mention work.
I was going to say teams,
It.
managing your boss, managing teams. I mean, we have a tendency in this phase of our lives to take care of everyone else first. And while it sounds cliche, self-care is not selfish. It is actually essential to your health. And it doesn't take an hour sweaty class every day. It takes 5 minutes here, 2 minutes there, 10 minutes here. And you cobble them all together, which is why calendar is on my wheel, as you know, Dr. Simon, because if we don't make time for it, none of these, including our sleep, will take place. I truly am, I'm crazy passionate about it. I believe that women in this phase need to change their mindset about health and wellness. And it's not about what somebody is doing on Instagram. It is not about what your friend is doing. It's about, again, theme of today is what is right for you and what fits you. And so I have a group of women here in my community. I work with them online and in person, in groups and in one-on-one setting. I go to corporations and I teach workshops. And I am crazy because I want to get this word out. I'm crazy about this topic, I should say, because I believe it needs to be talked about a lot more and then coupled with a foundation of health and wellness that's different. And actually, it's more exciting. I believe it's much more achievable than the societal norms that we learned in our teens, 20s, and 30s. Those were really hard images to keep up with. And now it's more powerful. I really believe strength begets strength. And the stronger we become emotionally and physically, the stronger we're going to be in our path for our wellness. I really believe it. I'm living it. I'm 57 years old, as you know. I feel better now at 57 than I did at 56 and back and back and back. I really believe it. Take charge.
And you're not alone. These women who are having this are not alone. There are between 7 and 8,000 women every day in the US by itself who are becoming menopausal. So you're not alone. You're not alone. We can help.
Yeah, and it's this common humanity that Dr. Kristen Neff, who I love to study, she speaks about self-compassion. She is the self-compassion expert in our country, but she talks about common humanity. So women, we are not alone. There are a lot of women. If you know a woman and you know a woman in her 40s, she is in perimenopause. She may not see it, she may not feel it, but she is definitely in it, or she's heading in that direction. So let's go ahead and wrap it up, Dr. Simon. This has been an incredibly enlightening conversation with you. I always learn when we're together. And we'll have to do it again, but thank you again for sharing your wisdom with all of us.
My pleasure.
And how can we get a hold of you? And then I'll share with the audience how they can get a hold of me.
So I have a Washington, D.C. office. We do both in-person and virtual visits. And that office number is 202-293-1000. We actually answer the phone.
You have an actual physical phone?
We have a phone, and we have people to talk to when they pick up the phone.
And they are wonderful people, because they are too. Also, his team is dedicated to helping women feel better. You could reach me at adriencotton.com. Adrien is Adrien, Cotton, COTTON.com. You can also find me on Instagram, Adrien M. Cotton. And we'd love to see you. My ideal patient, my ideal client is a woman who is in her 40s and beyond, who may be sensing it's time to make a change in how she approaches her health and her wellness and her body.
I can help too. Hormones are important. They're not for everyone, but let's have a talk about it and see whether they're right for you.
Perfect. All right. So we're going to sign off for you. We'll see you ladies soon, another day. Bye, Dr. Simon.
Have a good one.